Hello, I'm David Hillyard. I'm a professor of pathology at the University of Utah and director of molecular infectious disease testing at ARUP. The continuous improvement in treatments for chronic hepatitis C infection has been one of the most important medical achievements of our time. A disease that affects more than 3 million individuals in the U.S. alone can now be cured in more than 90% of cases. A critical breakthrough was the introduction of direct-acting antivirals, or DAAs, in 2011. Several classes of these drugs are now available for use either with interferon or more recently in interferon-free formulations. One of the most effective classes are the NS5A inhibitors. They're extremely potent when used in combination with other DAAs and are therefore commonly included in recently released pangenotypic treatment regimens. However, NS5A inhibitors have a relatively low barrier to resistance, and these mutant viruses, once emerged, have good fitness and may persist for long periods of time in the absence of selective drug pressure. Approximately 10 to 15% of HCV genotype 1 infected patients without prior exposure to NS5A inhibitors are found to have resistance-associated variants, commonly called RAVs, prior to treatment. Patients with genotype 1A infection with specific NS5A RAVs causing greater than 5-fold reduction in the activity of NS5A inhibitors are found to have significantly lower rates of response. Currently, testing for the presence of NS5A RAVs is recommended at baseline for patients with HCV genotype 1A prior to initiation of treatment with elbasvir plus grisopavir, and should also be considered for patients with genotype 1A and cirrhosis prior to sofosbuvir plus decladisvir treatment. The principal HCV NS5A mutations associated with resistance to NS5A inhibitors are at codons 28, 30, 31, and 93. Recently, ARUP has developed a sensitive nucleic acid sequencing test for these RAVs, which has been validated for both serum and plasma samples. Looking forward, it is expected that new generations of DAAs, including NS5A inhibitors with even greater barriers to resistance, will become available. At this time, selective use of HCV resistance testing provides an important tool for choosing optimal HCV treatment therapy. For more information regarding this testing, you can refer to ARUP's website.